Gestational diabetes is a risk factor for all pregnant women. Dr. Clara Ward and registered dietitian Joy Cornthwaite with UT Physicians explain treatment options to keep mom and baby healthy. Dr. Ward, we've heard of type 1 diabetes, type 2 diabetes, but what is gestational diabetes? I have a feeling it has something to do with being pregnant.
Indeed, it does. So gestational diabetes is diabetes that arises during pregnancy. And we know that all women are at risk for gestational diabetes. And the reason for that is all of the hormones that are in the placenta that help the baby to grow, they can interfere with your body's ability to process glucose.
All right, so what are the symptoms? We know that not all the time do we have certain symptoms, but are there symptoms that are present in gestational diabetes that we should look for?
It depends on, how severe. Oftentimes mom won't have any symptoms at all. And so this is why we screen all moms so that we can pick it up. It can have significant implications for baby, but mom may not realize.
The great thing with UT Physicians is there is like this continuum of care. So if someone is told they have gestational diabetes, you don't just leave it right there. And Joy, that's where you come in. You are a registered dietitian and you specialize in diabetes.
Yes, I do. I'm a certified diabetes care and education specialist, and I work collaboratively on the team with Dr. Ward and her patients to manage their diabetes during pregnancy.
All right, there are a couple of ways that we can take care of gestational diabetes. One, of course, is, as you just touched on, managing and kind of doing the things that we should probably do always.
What happens is we have ways in which the person and their family members, their support team, can manage their glucose, which include, of course, nutrition modifications, as well as being physically active, especially near eating times, and then properly hydrating as well. And when those things are achieved, then we can determine if there needs to be a medical treatment added onto that. And that's where we come in as their clinical team.
And Joy, it is so important when we're talking about how to eat and what to eat. That has a direct impact on the baby.
Yes, it does. And a lot of moms come into pregnancy, they already know that this is an excellent time to take a look at what's happening on your plate and modify it, because your biggest motivator now is this baby, is this little person. It's a really great time to meet up with a certified diabetes care and education specialist, a nutritionist, a dietitian, if you'd want to look at what you're doing and modify it and make it the best that can be for both you and for baby.
Yeah. And Dr. Ward, this is not one of those things that you want to ignore, because it could actually get dangerous for mom and baby.
Definitely. So, we know that moms who get gestational diabetes or during pregnancy have a higher risk of getting diabetes later on in life. So that's definitely one reason to get all of the information and get on board with some healthy habits now so you can be your healthiest self later. And during the pregnancy, we know that, if babies are taking on extra sugar, that can cause difficulties in adjusting to a normal sugar after delivery, as well as complications during delivery, such as even just a more difficult birth or a higher risk of a C-section, other complications.
Yeah, and it's so important to monitor something like this throughout the pregnancy, because as we know, our body goes through a lot of changes. Those of us who have been pregnant, you know that the hormones are kind of crazy. And so it's kind of like a moving target, because things can change hour by hour.
What oftentimes happens is, even if you're eating a balanced meal, even if you're eating your an appropriate amount of fruit and vegetables and protein throughout the pregnancy, as the hormones change, that may not be enough. So sometimes we have to give moms a little bit of grace to understand that there may be a medication or a medical therapy that needs to be added on top of all of the healthy human things that you generally do.
Dr. Ward, obviously, if we can prevent something like this, we would like to. So when you are doing your planning to get pregnant, or you first find out that you're pregnant, are there some things that you can do to reduce the risk?
Really just finding out about any medical concerns that you might have, getting more information about your own health, optimizing your health in anticipation of pregnancy. And certainly if you have a family history of diabetes, then being aware of that and making whatever healthy changes might make sense for your life prior to even embarking on pregnancy.
Well, ladies, thank you very much. There are a lot of unknowns out there, but as we know, there are some things that we can control for the best outcome for our babies.
Yes, there are.
Definitely.
And for more information on UT Physicians and to book an appointment, call 888-4UT-DOCS. That works out to be 888-488-3627, or visit utphysicians.com.